For my speech, I decided to talk about starting IVs. So at the hospital I work in the surgery department, and I train all of the new associates on how to do IVs. So whenever you start an IV, you always wash your hands first. And then there's an IV start pack. So I have that right here. So in your IV start pack, there is a tourniquet. So this is what the tourniquet looks like. It's really stretchy too. You can wrap it around the arms, the legs, wherever you're putting the IV. Typically you go in the arm, so you always wrap it around the arm. It ties. You just, however you want to tie it, it goes on pretty easily. So then you're looking for veins. You're going to clean it with the ChloraPrep. This is a ChloraPrep here. You have to squeeze it, because that's what makes whatever the cleaning product is. It makes it it breaks it open so that it gets wet. So this is already wet. So you scrub the skin with it for at least 30 seconds. After you clean the skin with the ChloraPrep, you want it to dry, so I let it dry for at least 30 seconds. So in that meantime, I take my saline flush and my J-loop. This is what you hook up whenever you finally start the IV. That's what you hook up to the IV catheter. So you open that up, and then the saline flush is going to be used to make sure that the IV runs okay before you hook up any kind of fluids to it. So saline flush is just 10 milliliters of saline. You hook it up, and then you just flush a little bit through so that there's no air in the tubing. So by now the IV, or the skin for the IV, is dry. So what you're going to do is take the IV. I have a 22 gauge catheter here. So you open it up, and this is the IV here. You always turn it in a circle. And I actually asked our instructor on why we do this. I knew we do it, but why do we do it? It's so that whenever you want to move it off into the patient's skin, it's just much easier to move because you already broke that initial when it's been stuck there for a while. So if you find the vein, the tourniquet is on, the skin is clean, all your other supplies are set up, you're going to find the vein, and whenever you start an IV, you're always parallel with the skin. And I have a video of me doing an IV, but you have no angle whatsoever. You're just going into the vein, and you're going to put it in the skin, and right away, if you're in the vein correctly, this is going to fill up with blood, and we call that a flash. So you're going to get a flash of blood, and thankfully, with technology, the blood does not just come right out anymore, so it stops right here, and then you push this forward into the skin, and then you hit this white button here that retracts the needle, and the needle is in this device here. A lot of people think the needle is in their arm. It's not. It is literally just this rubbery catheter here. So that's pretty exciting. So once that's in, you're going to take your J-loop, and you're going to, so let's just imagine that this is in your skin. You hook the J-loop up to it, you twist it on so it's secure, and then I don't want to make a mess in my desk here, so I'm going to leave it in here, if you can even see it. So I'm going to flush the saline in. So I'm going to push the syringe, and you can kind of see water pooling at the bottom there where that blue thing is. So I always flush the entire thing in just to make sure that the skin, or the vein, does work. So get rid of that. Don't need a mess in my room. So once that is in the skin, the J-loop is hooked up, you're going to take a Tegaderm. This is like a little clear bandage. It goes over the skin, so I'll just put it on my hand here. It just goes on. It's really sticky. So you just peel off the bandage that goes around it. Just like that. And then every IV start pack comes with some tape just to tape up the tubing so it doesn't go anywhere, but it comes right off. It's super easy. So I like to use the tape just to make sure that it doesn't go anywhere, because nobody wants to start an IV and then have it fall right out. So the Tegaderm is really going to hold it in place, as well as the tape.
In this video of me starting an IV, you see me tying the tourniquet that I showed you earlier. Unfortunately, on my phone, it only lets me record for 1 minute at a time, so I did not get to let the ChloraPrep dry fully or scrub for 30 seconds like I spoke about in my speech, but the girl I was starting the IV on was okay with it. And also, unfortunately, I did not get me turning the catheter hub. It is off camera, but I did do it. Now I am parallel with the skin, so I don't blow through the vein, and I'm inserting the IV or the needle into the skin, and then here you're going to see a flash of blood. I insert the catheter further, retract the needle, I undo the tourniquet, and then I get the saline flush and the J-loop hooked up, twist it on to secure it. I'm going to flush some saline in to make sure it runs okay, and you see the hub getting lighter, so that means the blood is going back into the skin. It is good. I get the tegaderm out, and I place it on to secure it even more. Take off the extra bandages.
So that is just the basics of starting an IV. There is a lot more to it. It's a lot more in depth on how to pick a vein, how to know where you want to put the IV. It depends on what kind of procedure a patient is having. Depends if you need blood. There's so many factors that go into it. I mentioned earlier that you're parallel with the skin. If you have any angle with your IV, you're going to go in through one side of the vein and out the other, which would make the vein swell up. It would be bleeding underneath the patient's skin. It would no longer work. It would not let you put any fluids into it at all. So if you stay parallel with the skin, you're just going to insert it right into the vein, and it just slides right in the vein. If you are moving around, it's going to nick the sides and it's going to bleed as well. So you have to have a very steady hand, and I train all the new associates on how to do IVs, so a lot of times they're very nervous and their hands are shaking. And I actually had this girl, I trained her on Thursday on how to do IVs, and she was so nervous, but once you get your first IV, after that, like the shaking of the hands, it goes away. Just the first initial IV start on any patient is terrifying, but once you get it, it's actually really rewarding. Seeing that flash of blood that we talked about, it's just like, it's like a good job, you got it. So it's a fun, I mean, maybe just for people in healthcare, but for me, it's a fun thing to do.